Great. So today's session is brought to us by Ushur. Ushur has been a longtime partner and supporter of both MHPA and our member health plan organizations. I'd like to thank the entire Ushur team for organizing today's session and sharing their expertise. Today's session is titled Modernizing Medicaid Redetermination Engagement in the HR.1 Era, and it is in partnership with Santa Clara Family Health Plan. Our presenters for today are Chelsea Byam and David Gonzalez. Chelsea is the Vice President of Marketing, Communications, and Outreach at Santa Clara Family Health Plan. She leads the organization's marketing, communications, digital engagement, sales, and community outreach efforts, bringing more than 15 years of experience. Before joining SCFHP, she led marketing and communication initiatives for nonprofit healthcare organizations with a focus on community engagement and patient education. David Gonzalez is the Strategic Sales Director for Ushur's healthcare vertical and the architect of their AI go-to-market motion across California's health plan market. His portfolio spans 4 of the 17 local health plans of California and several commercial payers, organizations where he translates agentic AI into measurable outcomes, lower costs to serve, stronger member engagement, and better quality performance. Before Ushur, David built his career inside and around the insurance industry, holding cross-functional roles at multiple carriers and advising organizations through enterprise technology transformations in communications, interoperability, and AI. We appreciate both David and Chelsea joining us and sharing their expertise. So just to kind of go over today's agenda, so today's topics for the presentation are David and Chelsea will touch on the new redetermination reality, a look at membership demographics, overcoming digital communication barriers, meeting members where they are for the redetermination support, and then best practices, member engagement at scale. And then, like I said, we'll wrap up with Q&A. So with that, I'll go ahead and toss things over to David.
Thank you, Eric, and thanks for having us here today. I've been called in to pinch hit for our CEO. So you're not getting him today. He's very sick, but I'm happy to join here, and hopefully I can do it justice. But we're going to start today by talking about the redetermination reality. Been living and breathing this topic for the last about a year now, ever since the legislative changes came out and the announcements did. So we're going to discuss that today and how member communications plays a role in hopefully mitigating the losses for that a lot of Medicaid plans are bracing for right now. So Eric, if you'll skip to the next slide, we're going to start with some numbers there. And I'm sure that everybody on this call is familiar with a lot of the numbers that I'm going to be speaking to here and knows what's in front of them as it relates to redetermination and having to recertify twice a year, having work requirements enforced, and all on a pretty short timeline. You see some numbers up there, but the big ones are about 10 million people are expected to be, additional people are expected to be uninsured by the end of this. 7.8 million of those are probably going to come from Medicaid. And then it's about $1 trillion shortfall in funding for all of these plans across the nation. And the sad part of it is that a lot of times the folks that do lose coverage are doing so not because they're ineligible, but because they didn't follow the process for enrollment or the right process for enrollment, because they either didn't know what was going on, weren't reached out to adequately, or just a host of reasons for these populations that aren't always informed appropriately about what's going on. So those are all realities that we're having to contend with. And unfortunately, this rigor that they're implementing inside of redetermination is not going to be supported by a corresponding or proportionate change or increase in funding to support these initiatives. So plans across the nation are being asked to do more with less, and at a pretty large scale. So everybody knows that here, but what we're really here to talk about today in conjunction with Chelsea and what they're doing over at Santa Clara Family Health Plan to support members through these new redetermination requirements is looking at the biggest lever that you can pull as an organization to mitigate these changes and these losses, which in our view is communications. It's very low-hanging fruit to just make sure that members are informed adequately about the changes and how they can respond to them. And that's a question of equity, of being able to get out there at scale through grassroots efforts, but also through digital communications. And we'll talk through how Ushur is supporting plans in that journey. So we'll talk about that more in a moment, but I'm going to go ahead and hand it over to Chelsea Chelsea is an expert at this topic, and I really admire the work that she's doing over at Santa Clara Family Health Plan. Great business acumen, but also a ton of empathy for their members and really structuring just this journey the right way to support them and to make sure that that it's doing the right things for the plan and also for the member. So Chelsea, happy to be here with you today, and I'll turn it over to you.
Thank you, David. It's great to be with you for this conversation and to share these insights with our larger Medicaid community. So I wanted to start by giving a little bit of a background on Santa Clara Family Health Plan. You can go to the next slide. Santa Clara Family Health Plan is a community-based and not-for-profit health plan. We're located in Santa Clara County in the greater Bay Area of the San Francisco Bay Area. We are a public agency, meaning that we do our business in public, but we're also established and connected to our county board of supervisors that created us back in 1997 to serve our members. We provide two lines of business, a Medicaid line of business, which is called Medi-Cal in California, and a Medicare product. We specifically provide a D-SNP to serve our dual eligible population. The next slide. So in Santa Clara County, we're serving about 15% of the total population. So despite the wealth of Silicon Valley, we still have a very large need for safety net programs and Medi-Cal insurance here. We're serving 275,000 members in our Medi-Cal line of business and just over 11,000 duals in our D-SNP, which our product name is Dual Connect. Our network here in Santa Clara County is over 6,000 providers and growing to be able to serve the needs of our members. We contribute over $2 billion to the local economy, making us a pretty significant partner for our providers here. And somewhat uniquely, we have $1.7 billion of that contribution goes directly to our county's health system, who are heavily involved in our hospital system, clinics, and the safety net care. Our staff is currently over 450 people, and we are represented with SEIU, which is Service Employees International Union. To the next slide. I wanted to talk about who our members are, because understanding our member demographics helps us better inform our communications and drive more effective strategies. So Medi-Cal populations can be pretty diverse, and it's no secret that Santa Clara County is a very diverse community. Over half of our members speak a primary language other than English. And so that means we even have 7 threshold languages, which we're required to provide all of our communications, both print and digital, in those languages. So English, Spanish, Vietnamese, Chinese, Farsi, Russian, and Tagalog. On the next slide, we take a look at the ethnicity of our populations. And ethnicity is important to us for many reasons, but it helps us understand kind of the cultural backgrounds that our members are coming from and how it might impact their perceptions of healthcare and how likely they are to engage and in what ways. So over 50%, or just at 50%, are Hispanic identity, and then Caucasian and Vietnamese follow behind that. We think about ethnicity and how we respond to our community's needs by offering culturally sensitive and culture responsive programs and activities and communications. Our community resource centers are kind of a highlight of our community engagement effort. And they're offering things like Lunar New Year celebrations or Hispanic Heritage celebrations, where we're partnering with our community-based organizations to bring culturally responsive programs and even things like flu vaccine clinics to the community in those places. On the next slide, the category of aid is a way we categorize our members based on how they became eligible for Medicaid. But for us, it provides kind of a high-level insight into perhaps some of the social determinants of health that they might be experiencing. So as we look at the largest population, which is the adult ACA expansion population right now, 35% of our membership, those are the members that are going to be most at risk for the redeterminations and the outfalling of the impacts of HR.1. Those families currently are able to cover their whole family, from child to their parents to their grandparents, because of the way that Medi-Cal has been expanded. And that is going to shift the way that we speak to our members and the way that we influence the health of our community as a whole. But we also think about how we serve our disabled community and our aged community through our communications. We really need to be mindful of ensuring that our communications are at a very easy, understandable level. We use 6th grade reading level as our goal. And we have to make sure that we're thinking about ways that they can access that information. So making sure that we have large print available, that our digital communications can be compatible with screen readers. All of those things help us ensure that we're able to meet our members where they are. but they also reinforce the need that there is no one-size-fits-all approach to be able to serve the needs of this diverse population. On the next slide, I'm going to talk a little bit about some of the ways that we have used our communication very thoughtfully to overcome the barriers that our members may have, knowing that they're coming from very different perspectives and diversity perspectives. So our digital communications journey has been several years in process, and maybe it's something that you can recognize or find yourselves in along the way, but really, before the pandemic, we heavily relied on traditional media and mail to communicate to our members. We sometimes would use mass communication like our website or social media to blast messages out, but it was a reactive approach, and just hoped that the members would find something that fit their needs. Somewhat fueled by the pandemic and understanding the needs to really focus on equity as our goal, we realized that we need to be able to meet the members where they are. And many of our members were ready for digital engagement. And so thanks to some of the flexibilities around engaging our members via text messaging, we were able to fuel ourselves into a place where we're offering multi-channel engagement. And I'll talk more about that on the next slide. And then lastly, I'll close out with where we hope to continue investing in technology and in people-centric strategies to be able to meet the needs of our members in this time. So the next slide, just to touch more on where we were. Our quarterly print member newsletter has been a very popular piece for their members. It used to be our primary communication vehicle. Anytime we had anything to send to our members, it went in that newsletter. We would also use mailed outreach letters, but those are often informed by claims data as to when there was something that members needed to do, months behind, and it was always in a reactive approach. Our digital channels at the time were only in English. And as we saw, there's a lot of different languages spoken that are the needs of our members, so we needed to be able to move away from that in some way. Our member portal at the time existed just to meet our regulatory requirements to allow our members to have a view-only access to their claims and authorizations. That doesn't really drive the engagement and build the trust that we need from our members. Many of these communications are also not that measurable and don't give you real-time insights to be able to pivot your strategies based on what you're seeing and hearing from your members. And of course, outdated and inaccurate contact information plagues us no matter what we do. On to the next slide. So as I mentioned, the pandemic kind of fueled our transformation, and we were able to pivot to multi-channel communications that showed true success during the PHE unwinding period. And now we apply those lessons to everything we do, whether it's redetermination, well child visits, annual wellness visits. We have a whole slate of traditional media, but we've also added the things that are in teal on the diagram. We have text and interactive digital messages that are able to be more interactive for our members. Our member portal is now a place where we can drive engagement, offer self-service options, and not just be a place where members may go if they need to see a claim or not. And our website, we're able to add translation features, so now that those digital resources can be available to all of our members, regardless of whether they speak English. Let's go to the next slide then. So our redetermination campaign was really seen as a success for us, and it started with gathering info about our members, helping them update contact information, helping them feel empowered and educated about the process that needs to take place, and then providing some information when things don't go as planned, and we can recover those members even if they've passed their renewal date. On the next slide, we'll go into a little bit more about this campaign. So we kicked this off during the unwinding period where we still wanted to capture opt-in for text messaging up front. So we would ask members to opt into the text. Once they opted in, we were able to present them with a secure HIPAA-compliant web app where they could update their contact information. This created this engagement and real-time feedback for us to see how our members were responding to this channel. And it gave us really important information about how to reach them. And of course, this whole solution was designed to be offered end-to-end in our full language support. And we can, as I said, it's been a success for us. We were able to achieve the 10% opt-in rate to text messaging through this campaign. That has continued to grow, and we've got almost 40% of our dual connect population has opted in to text messaging. And in California, the redetermination rates as we came out of the unwinding we're mirroring those before the pandemic, which all stakeholders agreed that was our goal, was to at least get us back to where we were. But we know that the stakes are changing, and pre-pandemic levels are not going to be sustainable. They're already falling, and we're losing members quickly. But we'll go there next. So we're going to show you a demo of our redetermination campaign in the next couple of slides. So thanks to a partnership with our county social services agency, we were able to get renewal dates from our county, and that way we know who's coming up for renewal and what kind of action they need to take. So we start our campaign by asking for opt-in consent. And then we remind them about the importance of keeping their contact information updated 60 days before their renewal. If we get updated contact information, we pass it back to the county so they can update their records and hopefully ensure that their renewal packet reaches the member. Then 30 days, if the county says, oh, yep, they're still outstanding on their renewal, we send another reminder letting members know that they have action they need to take to complete their renewal. Hopefully they take that action and they can successfully complete their renewal and their coverage continues. Let's go on to the next slide. So now we're going to give you the sneak peek into the actual text messages and how it looks. So let's click play. So this first message is our opt-in. Once they say yes, we just say, great, we'll continue to send text when we have things to tell you. So it's the next day that we send them a greeting to say, you might have gotten a renewal letter. Let's make sure you have your updated contact information. The web app opens. The member validates their identity, providing a date of birth that matches our records. And then it presents them with the address we have on file, both their home address and mailing address. If it doesn't, they can update their address right there in the app. Address, street address, apartment number, city, state, and zip. Once we get that information, it does do a quick check to make sure it's a valid address and presents it back to the member. They can choose to update their mailing address at the same time if they need to. Present it to the member to say, yep, that looks right. And they submit to us. Now we ask them for confirmation that we can share it back with our county social services agency. If they say yes, then we continue. And we also remind them that if they could update it in the state's benefits CAL portal, that will also ensure that they're getting the latest information right away, even before our data sharing with the county takes place. At the 30-day mark, again, if they haven't opted in, we prompt them with the opt-in again. If they have already previously opted in, would skip this step. And it would go right to the, did you get a renewal packet? And we frame this to be an engaging question so we could continue to track this engagement with this interaction. We provide them with a link to our website with all of the instructions about why it's important, how it's important, where they can get assistance with the renewal process. They say yes, then they would respond and say, great, so glad you're able to continue your yes, and return it into the county. So that's the current campaign as it stands. As I mentioned, we know that the stakes are higher. You can go on to the next slide. And so I wanted to share a little bit about how we're approaching the challenge of HR.1 and what we're going to do next, even as we're building this plane, as we're flying it. So we see this as a two-pronged campaign. One is to build awareness of the renewal process. Because there's changes happening, because there's so much confusion, having everyone on the same page about what's important and why it's important is really critical. So we will be publishing regular updates via social media and all of our newsletters to all of our target audiences. We have some email newsletters as well as that print member newsletter. We have a landing page on our website where we're going to update and maintain that with changes as they happen. Flyers are an important piece of this awareness effort, so that way our community-facing teams have that information and we can publish them digitally as well. Our partners and providers will be provided with all that same information, and we leverage some of the materials that our Department of Healthcare Services puts out, using that same language as much as we can to make sure that we're all singing from the same song sheet. We used advertising as we came out of the public health emergency to draw attention to the need for Medi-Cal renewals. And so we're going to be relaunching that ad campaign. We do some out-of-home and bus advertising. Even the inside of the bus has some places for us to include ads. And then we partner with community-based organizations. They are critical in reaching these populations that may not have both the language skills or the health knowledge to be able to navigate the system. We're going to be reaching out through community health workers and other partners in places where people are naturally congregating, thinking about churches, schools, senior housing facilities. Those are the places where we'll be able to connect with trusted messengers and provide this information at awareness level. Then as we move towards the right, we have, because of the data sharing agreement with our county, we have the opportunity to really drive action based on data. And so we're going to expand that renewal campaign that we just walked through to keep reaching our members. Maybe we'll tweak some of the messaging as well to figure out how we can really provide them with the information they need quickly and make them and encourage them to take action. We're also going to add a grace period reminder because we know that sometimes you just miss it or you didn't get the packet and then you still need to follow up after that during that grace period. And so we're going to add a text message there as well. Another thing that I'm really excited about is the addition of an AI chatbot on our public-facing website. And so we're working with Ushur on this right now. It'll be able to answer frequently asked questions, provide some self-service options to our members right on our public-facing website. We'll also train it around the same renewal information that we have on our website. Then, as I said, there's no one-size-fits-all approach. So digital is great, but we also need mail. And so we will be doing a mailing to our members who are in that grace period, letting them know that they need to take action, that their coverage with us has ended. Our member portal, as I mentioned, we've spent a lot of our efforts to drive engagement on our member portal, and it's really doing well. We've reached our goals for engagement on that portal. And so we want to make sure that that can reflect those alerts and push notifications about a member's upcoming renewal as well. Then next, for all of our member-facing teams, we're going to provide talking points so that they know where a member stands on their renewal and can answer the common questions about the changing requirements. When we can, we're going to offer renewal assistance at our community resource centers. So our community resource centers have our own community health workers who can provide help with navigating a renewal. They can scan documents in, they can answer common questions. We're looking at ways to expand the capacity for our community resource centers too, even using the limited staff we have. So if we think about how we can better optimize our workflows at the CRC to answer those quick questions, but also then filter out who needs to be able to sit down with a community health worker to understand what they need to do and the documents they need to provide. So this is a key piece of our strategy as well as that one-on-one assistance. Then lastly, we know we can't do it all in terms of one-on-one assistance. And our county is quite large, despite being serving just one county. So we want to facilitate training and provide funding to our community-based organizations to increase capacity for renewal assistance. We were using some of our reserve funds to be able to do that, and we have a couple of organizations that are working with us right now to be able to reach their populations with the information around their Medi-Cal renewals. We're also sitting at the table with other community-based organizations strategizing about what else we can do to be able to facilitate the successful completion of the work and community engagement requirements. And there's a lot of details that are left to be known about how the work and community engagement requirements will take shape and whether the members what actions they need to take to be able to meet those. But we're already at the table and having those conversations with a variety of organizations, not just healthcare organizations, about how we can be prepared to meet that moment. So with that, I'm going to hand it back to David to talk more about Ushur's capabilities.
Thank you, Chelsea. And some of the things that Chelsea mentioned there are things that are outside of member communications that are a huge boost. Working closely with community-based organizations, having that interoperability, those data exchanges, the data relationship with the county, those things are irreplaceable and go a very long ways. So when I talk about member communications, it isn't the only lever that organizations can pull, but we do think that it's a very meaningful one, and we're seeing that bear in practice. So we're going to talk today about matters of equity and making sure that we're meeting members right where they are, whether that's the device that they're on, the language that they speak, and a variety of other factors that make it appropriate for the person that it's intended to reach. So You saw in Chelsea's demo how they're doing outbound, and then she talked about their plans for inbound as well. So through the outbound side, a lot of carriers, a lot of payers come to us and say, "Hey, we want to do text messaging," and organizations like Santa Clara are doing text messaging the right way. There are things that you saw in that demo that you simply can't do through text messaging. It all starts with the fact that you can't convey HIPAA protected information through a text message. So having something like an interface that where you can exchange that type of information, that's sort of table stakes to having meaningful interactive experiences on the outbound side that, as you saw, can even pull in data that you already have that you can leverage to make it a good experience for the member, and make sure that they can appropriately update their data if they need to, but also present it to them and show them that, hey, we know exactly who we're talking to. So those are all things that are very much important. But what I wanted to focus on today from an inbound and outbound perspective is really AI, because as I said before, we're expecting a lot of losses. We're already seeing those losses come to fruition, and you're not getting the corresponding increase in funding to support this from a staffing perspective. So one of the best ways it comes at AI is coming in, and the maturity of AI is coming in at a very opportune time to help payers meet this moment, because it offers so much efficiency and so much cost savings as well, as long as you're doing it safely and you're doing it right. So from an inbound perspective, we see a massive opportunity for health plans to have interactive experiences right there on their landing page. Members are going to be coming to you for questions, whether that's through community-based organizations, whether that's through telephone, or if it's through your website. I expect a massive uptick in website traffic as people get informed about these changes and have more questions. And a lot of the websites today have a lot of information, but it's buried somewhere inside of the website and it's hard to access. So when you have a bad navigation experience, when you get to the website, it doesn't do what it's intended to do. So now that we can replace the chatbots of old with true agentic AI experiences that answer questions that are based on a knowledge base, can pull the exact answer that you need at just the moment in time, that's another layer of support for members that simply wasn't available before. That on top of the fact that it's available 24/7, it doesn't get tired, it doesn't take lunch breaks, all the tropes that you've heard about AI, those things are super important. What's also important is making sure that it's compliant and that you are looking at something that can support all of your compliance needs, both from a HIPAA perspective, but also from supporting the languages that you need to support. We talked about threshold languages, need to be able to support those out of the box and have the guardrails in place to make sure that the AI stays on the rails, and also is answering in a way that you want to your members at the appropriate reading level with the right amount of empathy, all the things that create a good, meaningful experience for the member. But members coming to your website from an inbound perspective and asking questions is a privileged moment also for a lot of organizations. If you can deliver on a good member experience there by answering the questions right in time, pulling up the right resource, whether it's a video or a link to the right information, those are all meaningful things that will aid the member experience. But if you're offering something like a covered California plan that could be an alternative, is if the member is truly ineligible, or maybe you have a DSNP offering, then being able to provide that good member experience gives you a lot of opportunity to suggest an alternative to the member. And we're seeing plans that are interested in implementing these types of experiences as well. So a lot of things that you can do from an inbound perspective to plug it into your IVR, so your phone experiences, your website, your member portal, et cetera. And having an agent that's always on that answers questions the right way is super important and can help you mitigate these losses, because members are getting the information that they need just in time. And of course, if they need the support, they can always escalate to a live agent. From an outbound perspective, it's equally important, and AI is delivering on a lot of the promises that we saw early on as well. So from an outbound perspective, you want to be able to text members, but also provide the same capabilities that you would on, say, your website, and be able to provide a chat experience that's interactive, can be escalated to a live agent if needed, but again, is grounded in truth and can provide an agentic experience that connects to different systems, can service tasks, We see a lot of plans implementing the ability to download an ID card through an interactive experience like this, update your contact information, and do all sorts of fun, interesting, cool technology stuff that helps provide a great member experience, the ones that you're used to seeing outside of healthcare, but also be useful in supporting Medicaid redetermination. And finally, from an outbound perspective, we can't forget about voice. We still rely on voice experiences a lot through the telephone. It's something that we're used to. And if you've gotten a call from an AI agent in the recent past, you can see how much the experience has improved compared to the old kind of robotic voices. Translation capabilities, the tone of the voice, the responsiveness, the lack of a lag, the timeliness of everything has all greatly improved. And it's all grounded in the same truth that your chatbot experiences are grounded in on the back end. So it's very effective in replacing the need to make a million different calls to a million different members about the upcoming changes. Having that as a lever is something that you can experiment with, and that could help you do the same outreach at scale, but with a lot fewer resources. And that's exactly what we're seeing play out in the field. So if we skip to the next slide,
David,
I want to talk. Yeah, please.
I just wanted to jump in quickly on the AI chatbot's ability to offer a self-service option to update contact information. I really just want to emphasize that we are super excited to be putting that into place because it's the #1 barrier we're hearing from our community and our community-based partners and our county social services agency is that people's contact information is just bad. It's outdated. They don't remember to update it. And so being able to offer this like frictionless experience to be able to update contact information right on our website homepage is going to be crucial for us as we move into this new time of needing to reach people more frequently rather than just once a year. So thanks.
Absolutely. It sounds so simple, but can be so hard to do. And having it be interactive, having it meet you right there on the website, those are all meaningful upgrades that weren't available just a few years ago, or maybe even a few months ago. Thanks for adding that, Chelsea. And looking at further enhancements to the member experience, I always go back to an experience that I had with an airline. I was in an Uber and I was on my way to the airport in San Francisco, and I was running late. I didn't think I was going to make the flight, and so I called the airline to try to change my flight. And as I was talking to them, they said I had like a 50-minute wait, and that just wasn't going to cut it for me to be able to change my flight. But they offered me the ability to go through a text message, and my objection to that was I don't want to lose my place in line. But they surprised me delightfully, and they sent me a text message, and they told me I wouldn't lose my place in line. So I stayed on the phone, and I was able to do what I needed to do from a self-service perspective on my phone through a text message. And I thought, what a wonderful experience. I came back all jazzed up to work, and I said, "Hey, had this great experience. Wanted to talk about it." And of course, our cracks inside of the AI lab said, "Hey, wait till you see what we have for you." And enter voice guided experience, which is a simultaneous voice and visual experience, which you can hold through your phone or through any device. But it's basically supporting the member as they both through voice and as they're looking at their screen, by knowing exactly what they're looking at on their screen and being able to respond both through the digital interface on their phone or on any device, but also through voice and updating concurrently, so the member never loses their place. So it's true synchronization of voice and visual. You're going to see a demo of this in just a minute, but you're also getting that visual task completion, and it eliminates it eliminates doubt that that what you're doing is actually getting updated. And of course, you always have the support of somebody there to guide you through the experience and make sure that they hold your hand through the process, which can be really meaningful in improving completion rates, not only for these Medicaid tasks or Medicaid redetermination tasks, but also the million other tasks that you want a member to complete as a health plan, whether it's filling out an HRA, an SDOH survey, You name the hundreds of use cases that we're seeing out in the field, but truly a differentiated experience that can support members through multiple channels and in multiple ways. So you'll see a demo of this on the next screen. Eric, if you could hit that, and I'll bow out for just a minute while they show you
Ushur's
this.
voice-guided experience, a simultaneous voice and visual experience that lets users speak with an AI agent while following along on a synchronized mobile screen, without switching channels or losing context. Let's look at the Medicaid redetermination process.
Hello, John. This is Fine Health calling to remind you that your Medicaid coverage will be renewing in the next 60 days. To maintain continuous coverage, you may be required to verify your eligibility. So it's important that we have your updated contact information so you receive all the renewal notices and documents. Do you have a moment to confirm your contact information?
Yeah, sure.
Great. I can help you confirm your contact information right now on this call. For a faster and simpler experience, I can also send you a secure chat link by text message. You'll be able to interact with me on both this call and chat at the same time. So it's not a choice between channels. Would you like me to send the secure link to your phone number ending in 7842?
Yeah, please.
I've sent you a secure link by text message. Please tap the link when you're ready. Once you connect, I'll guide you through confirming your contact information on both this call and chat. Let me know when you've opened the link. You are now connected to chat over a secure channel. I'm getting your contact information now. Please hold on for a moment. I've found your contact information. Please review the details in your chat window. Let me know if everything looks correct or if you need to update anything.
Oh, that's a really, really old email address. I'll need to update that.
No problem. Please enter your new email address in the chat window, and I'll update it for you. I've updated your email address. Please check your chat window to review all your updated contact information. Is everything correct, or would you like to update anything else?
The apartment number is wrong. It should be 350.
I've updated your apartment number. Please review your updated contact information in the chat and let me know if everything looks correct or if you need to make any more changes.
Nope, that is correct.
Would you like to update your preferred contact method? You can choose call, text, or email in the chat window.
Yeah, update it to text.
Your preferred contact method has been updated to text. You're a valued customer, and we appreciate you taking the time to keep your information up to date. This completes your update. Have a great day.
All right. So I think that's awesome. First of all, not just because we're doing it, but it just shows the evolution of a member experience, something that you could see happening in more of like a retail experience, industries that are less regulated, and taking all those things into account and still being able to provide that level of experience. Again, the AI voice without lag, and also that synchronized experience is fantastic. So if we go on to the next slide, I'll kind of round it out here, and then we can open it up for questions. And we'll wrap this up just by talking about how important inclusivity is. And this slide's meaningful to me because when I came over as an immigrant when I was 5 years old from Cuba, and my parents had to, we got Medicaid at the very beginning. It was one of the things that supported us and allowed us to thrive in the country. So very appreciative of the program in general. But one thing that my mom always said, who later went on to lead a community-based organization, was that it's all about it's not just about speaking the language, it's about navigating the system in the United States that really allows immigrants to be successful. And this isn't just about immigrants, but I can't imagine my parents going through an experience like this when we first came over without this level of support that ensures equity, that ensures support in the right language through the device that they're using. We know that a lot of these populations, the only access to a computer that they have is really through their phone. And someone adequately pointed out in the chat as well that there's limited digital proficiency as well. So being able to also support them through other efforts, through community-based organizations, and also through print is equally important. But really, it's that diversity of outreach at scale that will make a meaningful difference, that will not only lead to curbing the losses of these new requirements, but also just protecting your members, making sure that they have healthcare, making sure that they have or access to healthcare, and making sure that they have the support that they need from you, because you thought about what these campaigns would look like, what these programs would look like, and you reached them in a way that allowed them to respond and made them feel supported. So I'll turn it over to the QA unless, Chelsea, you had anything to add before we wrap up.
I'm seeing some great questions in the chat. So
awesome. Most of them are for you.
Yeah, so we do have a lot of great questions. Like I said in the little message, you can submit questions via the Q&A button at the bottom of your screen. So, and obviously the rest of the portion of the session is dedicated to Q&A. So please, we'd love to have a great, robust conversation. So just to go ahead and get us kicked off, David, first question is for you. For voice, can a tool like Ushur integrate with our CCAASs?
Yeah, absolutely. Whether it's interactive voice response, plugging into the phone tree. We integrate with pretty much all the CCAS systems, as they say, which are really telephony systems for those that don't know. So integrations that include plugging into like those phone trees, but also having visual experiences on dashboards, et cetera, that allow you to send ushers is also a capability that we have. Integrations are table stakes for us, and we know how important it is to be connected to all of your backend and customer-facing channels and systems.
And this might also be another logistical question for you. So is all the member engagement tools that were demonstrated, is that available as an app on their phone? How is that, is that an option for integration that way?
Yeah, so the way that we look at it is apps are very useful when people get to them. So once you get to your app, once you're logged in, then you can have exactly the experience that you want them to have. The challenge that we see a lot of health plans facing is that they don't get great adoption on those apps, so those experiences never happen. So what we take is an app-like approach that has fewer barriers to entry for the member, so they actually complete that self-service experience. We also can support interfaces for chat inside of an app as well. But our foundation has been what we call our invisible app, which is an app-like experience that the kicker is it's invisible. So you're just able to get into it without having to answer a bunch of questions, without having to remember your password or download an app. And that's really our secret sauce.
Great, makes sense. Chelsea, this next one's probably for you, but David, of course, feel free to chime in on your experience. What have you done to combat members that don't have access to technology or have that low literacy rate and ability that you mentioned? I know you mentioned the 6th grade reading level for all of your materials, but if you could expand on that, I think that'd be great.
Yeah, absolutely. I mean, we see in person and dedicated assistance to be a key part of the strategy. We know that there will be always be people who are not trustful of technology or just unable to access technology because of other barriers. So we do grassroots outreach with our community engagement team. They're out there at community events, senior housing facilities, schools, those kind of places where people are naturally gathering. They're providing information right there in the field, but they're also then referring folks to come into our community resource centers for that kind of in-person assistance that they may need. And then partnering with our community-based organizations to reach those who aren't going to be able to be reached through some of our digital means. So there's all hands on deck approach to reaching people where they may be most likely to be reached and most likely to take action.
Makes sense. And this next question is probably also for you as well. As a health plan, are you seeing interest in healthcare provider organizations to also message patients for redetermination? And what barriers have you experienced in sharing that redetermination information with providers?
Can you repeat that one one more time?
Yeah, absolutely. So as a health plan, are you seeing interest in healthcare provider organizations to also message patients for redetermination? And then have you experienced any barriers in sharing that information with providers?
Great, thanks. I just missed the word provider in there. So
No,
yes, providers are very interested. So we've had a lot of our providers, expressing their concern about falling membership to us. And so we are trying to think about whether they lie more on the let's have them help us with the driving awareness, or let's have them help us with driving action. And we need to be really mindful of both because as our county social services agency would tell us, there's a lot of messaging going out to members as they're due for renewal. So when we're thinking, well, maybe we should share renewal dates with them so that way our providers can also give reminders to folks when they're due for renewal and need to take action. There's a balance there of providing them with too many messages that would be confusing or misleading, knowing where you need to take the action if you're getting that from a lot of different places. But at the same time, if a provider is able to has someone in their clinic and then they're coming up for renewal and they're like, oh, if you don't take that action right now or in the next 30 days, you won't be able to come back to see me. That has motivation behind it. That is like, oh, I understand that this is how I keep access to healthcare. So we want to be able to leverage that, and we're working through some data sharing questions on how we can even get those renewal dates to our providers to be able to have that knowledge and inform their communications at the point of care, because we think it can be very beneficial when done thoughtfully. Thankfully, we've got great relationships with our providers through our joint operating committees and making those connections to have the conversations with our provider offices and design those strategies. But we're also working with some of our community-based clinics more on the awareness side, where they're out there doing advertising and radio ads, and they're talking to Univision in Spanish language TV channels to just generally share the information about renewals and the changing processes that are coming. So both are very important. We are actively engaged in both because providers have an important role to play.
That makes perfect sense. And I think that kind of dovetails into this next question with just kind of the cadence in which you reach out to everybody. So I know you mentioned the 60 days and the 30 days ahead of the renewal process, but how often do you expect members to actually respond and provide updated contact details? Do you outreach to them outside of those two windows, or is it usually just around those two windows?
Yeah, so the response rate where people are actually willing to provide their contact information via the Invisible app is pretty low. I think it's single digits to sometimes double digits. That's okay. We are happy with that because we know that there's never going to be one solution that's going to reach everyone and it's going to be the way that they want to engage with their health plan. So we're okay with the low engagement rates. That's where we're also thinking that this AI chatbot on our website will be another channel for folks that are looking for the easiest way to tell their health plan that their contact information has changed. But we're also, every time someone's on the phone with us, if we're able to reach them on the phone, we're asking and verifying contact information. We include those reminders about contact information in our print member newsletter. They can also update information in the member portal. So we try to reach them anywhere we can to encourage them to complete updated contact info.
No, that makes sense. That makes sense. And David, you might be able to chime in on this along with Chelsea, but obviously we're in kind of the spam and scam era where everyone receives 1,000 text messages and everything like that. What best practices or what tools have you guys implemented to help kind of build that trust that it is actually from Santa Clara Family Health Plan, right? Do you provide information ahead of time? Do you reach out to them prior, letting them know they're going to receive a text message or anything like that? What are kind of best practices and tools that you guys have seen that have worked efficiently help build that trust with the members?
Yeah, I'm happy to start on that. So we have a website, our webpage landing page that says we use text messages. Here's how we use them. Here's the number it's going to be coming from. We also put that on our on hold messages. Anytime anyone's calling us on our phone system, if they're sitting on hold, they might hear a message that says, we use text messages. Would you like to sign up for text messages? Our quality team does a whole lot of outreach to members to help encourage them to close gaps in care. And every time they're on a phone call, they're asking folks to opt into text messages because we also have all of these great gaps in care related campaigns that are helping members provide those reminders about upcoming appointments. So we're prepping everyone to know that there's text messaging going on. And so we've, our opt-in rates for text messaging are 30 and 40% based on our lines of business. So we feel like we've gotten really great adoption of text messaging from the kind of awareness level communication about it all the way to the action.
Yeah, I can't add much more than Chelsea's grounded experience within the health plan. But it's really about priming, just making sure that the member knows that text message is going to come with any opportunity that you get to. If they know that it's coming, again, they know what number it's going to be coming from, then they're very likely to respond. Once the member has received that initial text and that trust is established, response rates also increase because they're seeing a number coming from it's a text coming from the same phone number. They're seeing a call come from the same phone number. And of course, it's going to build trust. They can add you to the contact, to their inside of their contacts, et cetera. So it only gets better over time.
No, that makes perfect sense. And I know Chelsea mentioned she's super excited about the AI chatbot they're going to implement. So maybe David, you could touch on what guardrails do you use as you build the AI chatbot to keep it accurate and compliant and kind of in the scope of the conversation for the member?
Yeah, absolutely. This is we could probably spend a long time on this topic, but there are all sorts of guardrails. Number one, you got to make sure that the actual container, the place where the conversation is happening, is a protected environment, an encrypted environment. So obviously that's table stakes, but also anti-hallucination, making sure that the chatbot is or the agent is responding within a knowledge base, pulling from documentation that's yours, providing that level of response. So making sure that it's grounded in truth, making sure that it doesn't respond to kind of errant or random questions like, hey, can you get me concert tickets? There's a famous example of some car dealership selling a car for like $1 or something like that.
Yeah.
So those things have all been solved kind of a long time ago. But also jailbreaks and making sure that no bad actors can infiltrate. Our platform comes out of the box with these guardrails. And when you look inside of the platform itself and you look at the controls, you can already see how it's designed and engineered to do that. It's really a matter of architecture and a lot of thoughtfulness behind our AI. But yeah, we're focused on preventing guardrails, preventing hallucinations, making sure that it's a trusted environment, preventing jailbreaks, and then of course making sure that it answers based on documentation and information that you've provided to us, and then rigorously testing those responses through different evals and all sorts of cool AI methodologies that we've been implementing for a long time. Ushur's been doing AI since like 2018. So a lot of experience there and a lot of mechanisms to prevent the agent from going off the rails.
Great. Appreciate the insight. These next couple questions probably are for you as well. It's kind of fleshing out kind of the Ushur, system. Can Ushur fully replace an email campaign platform, or is it intended to be a bolt-on for AI workflows for a separate platform? It's the first one.
Yeah, so we don't want to be a rip and replace system. So we layer very neatly on top of existing tech stacks. For the specific question about email campaign platforms, I'm assuming you're talking about like a MailChimp or something like that. All the capabilities exist within the Invisible app and the way that you can configure it. It's a no-code platform. It's very easy to set up, and it supports HTML. It supports changing the language that languages and the language within, like the words within the message itself, for lack of a better expression. So yes, like you could send out email campaigns. You could tailor them the way that you need to. You could segment your population in a way that I don't believe is available on a lot of these email marketing platforms. So I'd say that there's a lot of enhanced capabilities, but also if you want to use that existing email campaign manager or system, we can also just plug right into it, embed links in there, and make sure that they're getting a protected experience, which is what a lot of these platforms miss.
Great. And that kind of dovetails into the next question, or to a degree. Does Ushur have pre-built integrations with Pop Health and Care management platforms? This question cited Arcadia, or is everything built custom via the API on a per client basis?
Yeah, we have a lot of out-of-the-box connections as it stands, but we do APIs all the time, and also, of course, with AI, that stuff is a lot more simple and supported all within the platform. So happy to provide like a list of out-of-the-box integrations that we have into care management, pop health, CRMs, email management, all the systems that you're using, and let you know what we have out of the box. But we've never let an integration stop us from helping out somebody that was interested in using our platform.
Great. Next question, Chelsea. Which channels are you getting the highest engagement rates right now regarding the Medicaid populations? I know you touched on a bunch of different ones, but have you seen one be more active compared to another?
Yeah, it's really hard to measure engagement equally across all channels because of the variety of the channels used and how you can really track the outcomes of those. But we are really satisfied with the engagement on our text messaging channels. The adoption rate, the opt-in rate for that has exceeded our expectations, honestly, because we've had such a conservative approach to asking for consent first. We weren't sure how much our members were going to be willing to do that, and they have. The other thing is that our grassroots and community outreach has really driven a lot of questions and interest and activity at our community resource centers. So the community-based, community-level outreach is paying off for us very much so. Our CRCs are busier than ever. And so, between those two things, having the high-touch, in-person places where we can connect with our members is being really positive, getting a positive response, and the digital, seamless opportunities to be able to take the action that you need quickly have been the most beneficial for us.
Amazing. Tons of great questions. We really appreciate the engagement with the audience. We only have a couple minutes left. So before we kind of wrap up, I wanted to give both David and Chelsea a chance, if you have any last, a final word or anything you wanted to highlight or anything like that before we close out, I wanted to give you guys the opportunity to do that.
So you want to kick us off?
Sure. I think we've learned a lot as we came through the pandemic and made it through the unwinding period of the pandemic about the importance of a no one size fits all approach to our communications, and that is more important than ever as we move forward into this new period. So that's what I challenge you all to do, is find the new ways to reach out. David.
Yeah, thanks, Chelsea. Couldn't have said it better myself. Again, looking at what levers you can pull, I think that this is the most meaningful one right now and the easiest to pull for organizations is just reach out to people in a way that they want to be communicated with and make sure that you're reaching them so they at least know about the changes and have a chance to respond. That's something that's within every health plan's hands and they have the ability to do. So make that decision. And if you want to learn more about Ushur, of course, get in contact with me. But really want to thank the MHPA team and want to thank Chelsea for having us on here today, and thank the audience for listening in. Eric, I'll turn it back over to you.
Yeah, and I will just echo your sentiment. I want to thank both you and Chelsea for sharing your time and expertise today. Obviously, member engagement is always a hot topic with the Medicaid plans and our members. So we appreciate you guys sharing your expertise. As mentioned at the top of the webinar, the session is recorded. So if you ever want to revisit the conversation, you'll be able to find the recording on MHPA's YouTube channel. And I know Ushur will also be sharing the slides as well, plus other information. As David said, if you want to get in contact with the Ushur team, reach out to him. You're also welcome to reach out to me. I'd be happy to connect you as well. Ushur has been a longtime partner and supporter of MHPA, and I can condone that their whole team is great. So with that, I want to thank everybody for joining us, and I hope that everyone has a great rest of their day. Bye, everybody.
Yeah.